Here are 3 USMLE-style questions focused on Schistosoma species, including clinical manifestations, transmission, diagnostic features, and treatment, with detailed explanations for both correct and incorrect options. Question 1. Transmission and life cycle. A 29-year-old man returns from a trip to rural Egypt where he swam in freshwater lakes. He now presents with fever, eosinophilia, and abdominal pain. Stool examination shows eggs with lateral spines. Which of the following best describes the mode of transmission of this parasite? A. Ingestion of cysts in undercooked fish. B. Penetration through the skin by cercariae from contaminated water. C. Inhalation of spores from dry soil. D. Fecal oral ingestion of eggs from contaminated vegetables. E. Bites from infected flies. Correct answer? B. Penetration through the skin by cercariae from contaminated water. Explanation: and Schistosoma spp, especially S. mansoni and S. japonicum, are transmitted when cercaria, larval form, penetrate intact skin during contact with freshwater contaminated by snail larvae. This is common in endemic areas such as Africa, the Middle East, and parts of Asia. Why not the others? A. Undercooked fish, Diphyllobothrium latum. C. Inhalation, not typical for parasitic infections. D. Fecal oral, Giardia, Entamoeba, Ascaris, E. insect bites, Leishmania, Trypanosoma, Lolo. Question 2. Clinical presentation and species. A 40-year-old man from Sudan presents with painless hematuria. Ultrasound shows bladder wall thickening. Urine microscopy reveals eggs with terminal spines. Which of the following long-term complications is associated with this infection? A. Hepatocellular carcinoma. B. Squamous cell carcinoma of the bladder. C. Renal cell carcinoma. D. Transitional cell carcinoma of the urethra. E. Pancreatic adenocarcinoma. Correct answer: B. Squamous cell carcinoma of the bladder. Explanation: chronic infection with Schistosoma hematobium is linked to painless hematuria and increased risk of squamous cell carcinoma of the bladder, common in Africa and the Middle East. Why not the others? A. Hepatocellular carcinoma associated with hepatitis B/C aflatoxins. C. Renal cell carcinoma linked to smoking, von Hippel-Lindau syndrome. D. Transitional cell carcinoma, most common bladder cancer in U.S., not linked to schistosomiasis. E. Pancreatic cancer, not associated with schistosoma. Question 3. Treatment. A 35-year-old rice farmer from Southeast Asia presents with chronic diarrhea, abdominal pain, and hepatosplenomegaly. Stool ova show Schistosoma japonicum eggs. What is the most appropriate treatment? A. Albendazole. B. Mebendazole. C. Metronidazole. D. Praziquantel. E. Ivermectin. Correct answer: Praziquantel. Explanation: Praziquantel is the treatment of choice for all Schistosoma species, including S. mansoni, S. japonicum, and S. hematobium. It increases membrane permeability to calcium, spastic paralysis of the parasite. Why not the others? A and B. Albendazole, mebendazole, used for nematodes, e.g. Ascaris, Enterobius. C. Metronidazole, used for protozoa, e.g. Giardia, Entamoeba. E. Ivermectin, used for filarial infections, e.g. Onchocerca strongyloides. Let me know if you